Welcome back to Toledo Clinic TV. Our guest is a physical therapist, Caroline Humberston. Thank you for being with us. There are many ways that we can be using our body as an exercise machine, for instance. Let's say you don't enjoy going to the gym or you can't afford to go to a gym. There are simple things that you can be doing at home, correct?
Correct. So if your goal is strength building and you have a higher level of function, you don't have osteoarthritic knees or a bad back, you can do things like lunges, squats, planks, push-ups, even tricep dips and things like that. All of those things are easy to do at home with a couch or a chair.
And how do you know if you're doing it correctly?
Generally, if it doesn't hurt, it's okay. If you're hurting, something's wrong.
Because you want to obviously get the most out of your exercise.
Right, using the right muscles to exercise really makes a difference. If you don't use the right muscles, then you're not accomplishing the right things.
So by the time you see patients, many times it's because of an injury or
Correct.
because they have done something incorrectly.
Correct.
And so what advice do you give them?
If it doesn't feel right and you're doing it over and over again and you can't seem to figure it out, come in for a consultation. We can teach you how to do it the right way. We can simply watch you squat and understand where the deficit is. If it's a tight hip, if it's a tight ankle, if it's a weak hip or a bad knee, we can simply watch your squat and be able to identify what the problem is and help you through that.
So in addition to using your body as a way to exercise, you can also use your body as a way to heal itself if you're doing things correctly.
Exactly. Like a lot of women, we're trained that when we wear skirts, we keep our knees together. So when we go to bend over to get something out of the cabinet or we go to stand up from a chair, we keep our knees together and we go to stand up. Well, what happens when you do that is you utilize the inner thigh muscles instead of your glute muscles, which is your butt. And when you don't use your butt muscles and you use your inner thighs instead, it's a really lot of pressure on your hips and your knees and your back.
So those kind of repetitive injuries can cause problems and cause them to have to come to see you.
Exactly.
What other kinds of things might we be doing wrong at home that you can give us some simple tips to help us correct those things?
It's hard to show you sitting down, but we can. When you bend over to go get something out of the cabinet, for example, you want to bend your knees and your hips. Everybody knows to bend your knees and everybody knows to bend properly when you go to pick up something heavy, but it's something simple like lifting a Kleenex off of the floor or bending over to get a pot or a pan out of the lower cabinet that we do incorrectly. We're not thinking. We just do it too quickly and do it incorrectly, using our back excessively. We don't bend our knees, for example, things like that.
Are there a lot of repetitive types of injuries that you see in your practice?
Very much so.
Give me an example of some of those.
An example would be hip pain. People misconstrue back pain for hip pain, and when they have a pain in the back of their hip, for example, that's really generally related to their lower back, not to their actual hip. If it's a hip pain problem, it would be the front of the hip. And you get a lot of these front on the hip and back of the hip pains with that bending incorrectly thing when you keep your knees close together. Another example would be reaching overhead frequently, and you utilize your shoulder muscles a lot, but your shoulder blade is supposed to rotate when you lift your arm up. If your shoulder blade doesn't rotate like it's supposed to, things get pinched and you get a shoulder impingement, which is another common injury with repeated lifting. Sometimes it's just as simple as trying to get that shoulder blade to move a little bit better.
And so are most of these problems easily fixed by going to a physical therapist and learning some correct exercises?
Yes, if we catch them early enough, it's really easily fixed within 2 or 3 sessions. If it's gone to the point where that shoulder impingement then becomes a rotator cuff tear, then we need surgical involvement and we need other things to help us fix those things.
And you'd like to avoid that, of course.
Of course.
Right. Okay. Thank you very much.
Thank you.
We will be back in just a moment.